Give a couple more examples. And we're not saying this so that people at home who may have this issue in their family thinks that we're promoting or trying to convince you to go in and be treated this way. But let's talk a little bit about the spectrum of patients you see.
Sure. So obviously in pediatrics, let's stick with that. I mean, the most common is epilepsy. And so the two, most common reasons that they will come is their seizures are not being controlled on the regimen that they're on, or their seizures are relatively well controlled, but the side effects are overwhelming. So they're looking for alternative. So seizures would be one, or epilepsy would be one. Probably the next most common would be getting into the oncology world. So patients who are dealing with their chemotherapy, nausea, the common side effects that they're dealing with, that modern medications either not working or they're sedating. Zofran, which another name on ondansetron, which is for anti-nausea or against nausea, it's sedating.
Wow.
So a lot of parents don't want that to be given, or they, for whatever reason, they can't. So something as simple as CBD, might help or get their appetite back.
Yes.
If there's some THC in there. So the oncology world. Now, what's specific about the oncology world is, and this is the tricky part of what I do, is that there are some families who are completely against chemotherapy, radiation, for whatever reason, and it's not my duty to judge, and looking for cannabis medicine for treatment.
Yes.
That's a little bit difficult because I don't think we're at a point that we can say A cures B.
Correct.
So what I try to do is to provide to them a service where we can intertwine what's going on while working with their oncologist. And again, but as you probably know, there are some in the lab studies where some cancers, are being, are being
it's in Israel.
In Israel.
That's also different delivery system too.
And most of those are cellular data, meaning they're looking at cell lines. The other, and to me, which is the most fascinating, are, and I put these in the same spectrum of autoimmune diseases that involve pain. So, for instance, rheumatoid arthritis.
Yes.
There's something called Ehlers-Danlos syndrome, which is, when you and I were growing up, we used to see people that could pull their fingers back. They were very flexible.
Yes.
Well, there's actually a syndrome where that's not normal, and they can suffer from chronic pain. And then the third one that along those, it's not an autoimmune disease, is sickle cell disease. All of those, at some point in time, because of their pain, get into narcotics.
Yes.
Sickle cell being the worst. So just like in the adult world where patients have been getting off narcotics or methadone and moving on to cannabis, we've been able to see a similar thing in terms of just pain control, getting off of those medications.
Gotcha.
And then where I've taken it a step further